We are really, really excited today to have speakers from the International Foundation for Gastrointestinal Disorders to talk to us about IBS.
Just to give you kind of a brief overview of this presentation, I'm just going to tell you a little bit more about myself, and Haley included, tell you a little bit about the history of IFFGD, kind of what our organization does and how we got started, tell you a little bit about irritable bowel syndrome and the awareness campaign that is actually currently going on right now for the month of April.
My name is Haley McCorkle, project manager for IFFGD. I've worked with IFFGD since 2018, but I've been in the GI space for a few years now and have family members who have also suffered from not only IBS, but other GI disorders. So being part of this organization is very near and dear to my heart, and I love being part of the awareness campaigns and programs like this today. I'm just thrilled to be able to speak on IBS Awareness Month this year.
So my name is Alyssa Sutton. I'm the project coordinator for IFFGD. I typically work more with the GI patient community side. I've worked with IFFGD now for almost 3 years, and 2 of which have been as the project coordinator. It's been extremely rewarding and eye-opening to work with GI patients. I suffer from irritable bowel syndrome myself, but it's been very eye-opening seeing how disorders like IBS can affect day-to-day life. So just to give you guys a little background on our organization, we are the International Foundation for GI Disorders, otherwise known as IFFGD. We were founded back in 1991 by Nancy Norton. She was a patient herself that suffered with a chronic GI disorder known as incontinence ever since she gave birth to her child. Our name has changed throughout the years, probably upwards of 15 times, but our purpose has always remained the same. Our mission is to inform, assist, and support people that are affected by GI disorders. And we do that by working with different patients, families, researchers, employers, and regulators to help provide educational resources written by physicians and experts in the field. We help advocate for digestive health, and we try to help support and encourage research in order to help adults and children that are suffering from chronic GI disorders. So irritable bowel syndrome is known as IBS. It is considered a functional GI disorder. That just means that the primary issue is an alteration in which your body is working. So you won't really typically find something like inflammation or any type of structural abnormalities when you go in for any diagnostic exams or x-rays. But there is a problem with the way that your GI tract is functioning. Irritable bowel syndrome is actually characterized by 2 key components. The first is an abdominal component that has been generally described as pain or discomfort. And the next is a change in your bowel habits, which could center around the changes in stool texture, so how your bowel movement looks, or the frequency of your bowel movement, so how often it occurs weekly or daily. This disorder is typically classified into 3 different subtypes that are all determined by the predominant symptom that is present. So there's IBS with diarrhea, where your predominant symptom is diarrhea. There is irritable bowel syndrome with constipation, where your predominant symptom is constipation. And then you can also have something called IBS mixed, which is really just kind of the alteration between constipation and his symptom journey is kind of unique who has IBS. There's no 2 patients that are really alike. But the majority of patients do say that their most troubling symptom associated with IBS is abdominal pain. This is not only just due to the intensity of the pain, but also the frequency of the pain. So how often that pain occurs and how long. Other symptoms associated with IBS can include bloating or distension, gassiness, mucus in the stool, a sense of urgency, or just the feeling of incompletely evacuating the bowel movement. Some of these symptoms or all of these symptoms can occur at the same time. Symptoms can be worse than others, and they can also have periods where symptoms subside and it feels like you don't have IBS anymore. The main type of bowel movement experienced can also change over time. So you may start out with IBSD, and that can change into IBSC or a mixture of both due to different changes in your diet, changes in your lifestyle, the use of over-the-counter medications, and also the use of prescription drugs. The following symptoms that you see are actually not typically characteristics of IBS. So if you do experience these symptoms, you should always discuss this with a healthcare provider to ensure that there's no more serious or life-threatening condition that is present. But these symptoms include anemia, which is a condition where your body does not produce enough healthy red blood cells, blood in the stool, new symptoms if you are over the age of 50, any unexplained or unintentional weight loss, fever, or diarrhea that can wake you up from your sleep. I want to just kind of touch on this very briefly. We noticed that a lot of people kind of confuse irritable bowel syndrome with inflammatory bowel disease. So I just want to talk about how these two disorders are in fact different from one another. So the first is, like I mentioned, your IBS is that functional GI disorder. So your diagnostic exams and your tests are going to appear normal. Everything's going to look fine on all of those tests. Now, IBD, or inflammatory bowel disease, is an autoimmune disease, meaning that your tissue is actually going to start attacking itself, and it creates chronic inflammation and can lead to potential damage of your GI tract. The symptoms, though, are very similar, which is, I think, why most patients do get these confused. They have abdominal pain, diarrhea, cramping, and bloating in common, but symptoms of IBD are typically also going to be with a fever or with blood in the stool, or you will experience some sudden unintentional weight loss. So although these two are similar with certain aspects, they are in fact very different from one another. IBS is actually one of the most common GI disorders, affecting 5 to 10% of the population. And you can see here I have a chart. Worldwide, we have 5 to 10% of the population that is affected, but within the US, that number grows to 10 to 15% of the population. Those in the United Kingdom, they're seeing about 5 to 10% of the population, but closer to 5%. And in South America, it's from 15 to 20%. IBS does affect both men and women, but studies have shown that there is a much higher prevalence in women than in men. And you can see here that about 67% of females have IBS and about 33% of males have IBS. Now, IBS itself does not actually shorten a person's lifespan, but studies have shown that it can create a large healthcare or economic burden for patients. There is an increased number of healthcare visits yearly and diagnostic tests and potential surgeries that patients need. So patients can spend up to $5,000 as an average direct cost per year for IBS symptoms. IBS can also significantly impact the quality of life. Patients do report that they feel general distress while dealing with kind of everyday activities like eating out at restaurants, going to social or family gatherings, traveling, going to school, and it can even affect your sexual relationships. And while nearly 40% of all gastroenterology visits are for IBS symptoms, this disorder itself remains significantly underfunded and significantly misunderstood. So as I've mentioned a couple times, and I'll keep mentioning it, IBS is that functional GI disorder, but it's also known as a disorder of the brain-gut interaction, which basically just means, you know, our central nervous system and our enteric nervous system, we have a bidirectional communication, and something that is relevant to the communication system can get mixed up and cause IBS symptoms. Now, while the actual cause of IBS is still misunderstood and unknown, we have had research that suggests that the symptoms can be caused by one or more of the following things that you see here, which could be either an improper functioning of our immune system, a disturbance in the way our gut motility is working, the way that our central nervous system is interpreting painful signals coming from our gut, and also a disturbance in our gut microbiome. And I want to kind of hone in a little more on that last one that I mentioned, because if there is a disturbance in your gut microbiome that is typically considered post-infectious IBS, it's also been referred to as traveler's diarrhea. And a lot of individuals will have IBS symptoms after a GI infection occurs, which could happen due to food poisoning, things like salmonella. SIBO can have an impact on IBS symptoms. So all of those things, any type of GI infection can give patients IBS symptoms. Sometimes, as soon as that GI infection subsides, those IBS symptoms will go away, and sometimes some patients will have them longer term. The diagnosis of IBS in the past has been typically based on symptom criteria, and also the elimination of more serious conditions, so making sure you don't have celiac disease or IBD and things like that. But recently, there have actually been 2 blood tests that have been designed to detect certain antibodies that are going to be present after a GI infection occurs. So those 2 blood tests are known as the IBS SMART test and the IBS check test. And while this is such a significant breakthrough in the detection and diagnosis of IBS, this doesn't help with the detection of IBS-C and Having a negative blood test come back does also not necessarily conclude that irritable bowel syndrome is not present. I thought this was just kind of a fun fact to share because I don't think a lot of people really know this, but serotonin is actually a neurotransmitter that can work as a hormone inside of our body. Those neurotransmitters send messages between our nerve cells in our brain and throughout the rest of your body. So when serotonin levels are impacted, it can have an impact on things like your learning, your memory, your mood, your hunger, your sleep, and also just kind of your body temperature. And while most people assume that because it's neurotransmitter that it's actually produced in our brain, but 95% of the serotonin that's found in our body is actually centered in our gut. Our gut has a very close relationship to how our GI tract is functioning with our moods. So if you have, let's say, a more stressful day, it can mean that you're going to have more troubling symptoms. And in contrast, if you have a less stressful day, it can mean that your flare-ups are going to subside. Management and treatment options are pretty much the #1 reason that patients contact our organization. They can also contact our organization to help them find physicians that can help diagnose IBS or help them manage their symptoms as well. But one of the ways that people can help manage their symptoms is by doing simple diet and lifestyle changes. This can include incorporating more physical activity into your day, being able to manage your stress levels, however that looks like for you, sleeping better, which I know can be very difficult for all of us, but actually getting that 6 to 8 hours of sleep a night, and also being able to identify and eliminate the foods that are triggering your symptoms. And I think the eliminating part is the most troubling because we all like those foods that make us feel good or that are super tasty, but those foods may essentially make your symptoms worse. So identifying and eliminating is very difficult, but a simple change that can be made and can help. One diet that is, I guess, more popular with IBS patients is just by adding or eliminating certain types of fiber from your diet. So if you have too little fiber, it can actually make your symptoms of constipation and abdominal pain worse. And then if you have too much fiber, it can lead to very uncomfortable gas because now your body is breaking down all of that food at a much faster. So tips to kind of boost your fiber intake can be to snack on fruits or nuts, add veggies, lentils, or canned beans to your meals, and opt for higher fiber bread and cereals. As I mentioned, different types of fibers can also impact your symptoms. So it's best to work with a healthcare professional to identify which types of fiber are actually triggering your symptoms, because it might not be all fiber and it may just be a certain type. But so the next diet that is typically used is called the Low FODMAP diet. FODMAPs are short chain carbohydrates. So it's basically your sugars and your fibers that are often poorly absorbed in your small intestine. And so FODMAPs is actually an acronym. The F is fermentable or gas producing. The O is oligosaccharides, which is your simple sugars like fructans and galactans. Your disaccharides are your double sugars like lactose, and your monosaccharides are your single sugars like fructose. Your polyols are your sugar alcohols. So your sorbitol, mannitol, isomalt, and the glycerol, those are all considered your polyols. I have this little infographic on the side that kind of shows you the different types of foods that contain high FODMAPs. There's a big misconception that a food that is high in FODMAP, because if you have a low FODMAP diet, that you'll be healthier. But actually, a lot of the foods that contain high FODMAPs are actually very healthy for you. So you have fruits, vegetables, legumes. All of those things can contain high FODMAPs, which makes this diet very restrictive and very difficult to do. There are 3 different phases of this diet, which are the elimination phase, the challenge phase, and the personalization phase. And all of these phases last a certain number of weeks, and then you start reintroducing the FODMAPs back into your diet. And what this allows your body to do is identify which of these high FODMAP containing foods may trigger your symptoms. So it's not a no FODMAP diet. It's not completely eliminating FODMAPs from your diet completely. And it's just important to remember that because this diet can be so restrictive, because it does eliminate a lot of healthy foods from your diet, it's so important to work with a registered GI dietitian that has been trained in this specific types of diet, especially because there is a lot of conflicting information online, which can also make it difficult to go through all of the stages accurately and appropriately for your body. FODMAPs not only can cause bloating and a lot of distension because you're breaking down the bacteria in the way it's being fermented. But it can also pull water into your intestines, which can essentially speed up your motility, leading to those loose stools. And so, like I said, it's just so important to make sure that you're knowledgeable in this diet, that you're working with a healthcare professional, and that you're maintaining the important nutrients that your body still needs while eliminating certain FODMAPs from your diet. If you are somebody who cannot find a GI dietitian, one of the resources that IFFGD does offer is a dietitian listing, which is comprised of over 300 healthcare professionals that generally can assist you right from your own home. A lot of them have telehealth portals that allow you to do it from the comfort of your couch if need be. I know that finding a GI dietitian that is specially trained with GI disorders can be difficult, so you can always access this by scanning the QR code, or you can just visit our IFFGD.org website, and you can find that under our list of resources. So another type of treatment that is actually great for patients is some complementary and alternative treatments. So complementary therapies are really just done alongside of other medical treatments, and your alternative therapies are going to be instead of medical treatments. This can include things like changing your diet and adding more herbal therapy into it. It can include somatic therapies like your acupuncture or just getting massages on a regular basis. It can include the mind-body therapies such as hypnosis or meditation. And it can also include movement or breathing exercises such as yoga or Tai Chi. Hypnotherapy is probably like the #1 most skeptical treatment that I hear patients comment on, because most people don't believe in hypnosis, but they also don't think that they would be able to be hypnotized enough for that type of treatment to work. But studies do show that up to 80% of people can be hypnotized enough in order for it to be successful. So you don't actually need to be in a complete hypnotic state for it to help with IBS symptoms. Another type of therapy is known as cognitive behavioral therapy, which is essentially just rooted in the belief that your thoughts are going to influence the way that you feel, and the way that you feel influences your behavior, and then your behavior kind of reinforces those thoughts that you're having. So CBT is really short term, it's very collaborative with your healthcare provider, but what it's going to do is it's going to allow you to kind of eliminate those harmful effects of that fight or flight response when stress has been triggered by symptoms or when symptoms are triggered by stress. Some patients have to use different medical therapies like over-the-counter medications or prescription drugs in order to help manage their symptoms, and that's totally okay. This is a list that kind of shows you the different types of medications. We have those that help IBS-D and those that help IBS-M, and then those that help IBS with constipation. Sometimes one type or one class of drugs can work for both or all kinds of IBS. I guess I should say all 3 types. And sometimes they can only work for one type. And so I'm going to kind of briefly explain the medications that are different options for patients. But also I just want to emphasize that Haley and I, we are not physicians. IFFGD does not have any medical staff. So it's just important to remember that anything discussed today, even if it's over the counter or a prescription drug, it's so important to remember to talk with your healthcare provider before adding or accessing any of these medications. So the first, and probably one of the most commonly used, is a laxative. There are 3 different types, which are known as the osmotic, the stimulant, and the magnesium-based laxative. These help by really increasing the frequency of your bowel movements while also helping to loosen the stools. The first one, the osmotic or Miralax, is actually the brand name version of this. This is the one that has actually been evaluated in clinical trials to help with IBS-C. And it's also used for people that also have chronic idiopathic constipation. And it really does help increase that frequency and that stool texture. But it does not seem to have any effect on the actual abdominal pain or discomfort that patients experience. And many patients actually report that their abdominal pain gets worse alongside of taking a laxative. Effects of this, some side effects that you can experience are diarrhea, more abdominal pain, the bloating, nausea, and in certain rare cases, it can also affect you by being dehydrated and or having an electrolyte imbalance. Antidiarrheals are also used for the IBS-D or IBS-M. They help by kind of slowing down the transit or the motility of the food in your gut. and they decrease the intestinal secretion or the movement of fluid to the intestines while increasing the amount of fluid that's being absorbed by your GI tract. So things to know about this is that loperamide or Imodium, they are over the counter. They are known to solidify loose stools and reduce the frequency of your bowel movement. But again, these, just like the laxative, don't actually seem to have an effect on the abdominal pain or discomfort and may in fact cause you more abdominal pain and discomfort. Some side effects to consider when taking an antidiarrheal is that it could increase the abdominal pain and you could experience constipation that can actually become severe. So it's important to talk to your healthcare provider before starting something like this, even though it is just an over-the-counter medication. Sometimes antidepressants are also prescribed. There are two different types that are typically used for symptoms of IBS, which are your tricyclic antidepressants or your SSRIs, which are really just it's called the selective serotonin reuptake inhibitors. And what these do is they help impact that nerve signaling from your brain to your gut, and that can either increase or decrease the function of your GI tract. These types of, or antidepressants, are known as global treatments, which essentially just means that it can tackle multiple IBS symptoms instead of just one. And these are typically prescribed at a much lower dosage than what you're going to see if you have something like anxiety or depression, and that's why you're taking these types of medications. Some side effects of this are drowsiness, dry mouth, diarrhea, headaches, and blurred visions. And so I guess just for this, the overall effectiveness of these drugs can vary between patients. So it's not typically the first thing that's prescribed, but it's always something that you can talk to your doctor about. Antibiotics, there's one that is FDA approved for the treatment of IBS-D and IBS-M. That is rifaximin. What this does is it modifies the structure of the bacteria or the function in the gut, and it's able to kind of target that small intestine and essentially stop harmful bacteria from causing the diarrhea symptom. Patients are going to take this antibiotic for up to 2 weeks. I believe it's 14 days or as prescribed. And you can have up to 2 successive treatments if the first one does not work. So you can take this treatment 2 more times if necessary. Side effects are pretty rare. If you do experience any, it may just be nausea. This medication is FDA approved for any type of patient that is 12 years or older and experiences IBS-D. Another class of drugs is known as your direct serotonin agonists or antagonists. Because it has that serotonin in there, it's going to help with the gut motility, your sensation in your gut, and also the fluid that's being secreted by your gut. There are 2 different types, one that treats IBS-D in just women and one that treats IBS-C in, again, just women. The first one is tegaserid, which increases the gut motility and intestinal secretions by targeting the nerves and the small muscles inside of your GI tract. Side effects of this medication can include headache, dizziness, back or joint pain, nausea or vomiting, or even diarrhea. Like I said, this medication is only approved for women with IBS-C, but it is actually also only in women that are under the age of 65. So any woman over the age of 65 would most likely not be able to take this medication. The next one is called olozatran, which works by delaying the gut motility and actually reducing the pain that you feel. This medication is only approved for IBS-D in women and only those with very severe symptoms, which is important to know because this type of drug was actually taken off the market. I can't remember if it was 2004, 2007, but it was specifically for severe symptoms of IBS-D in women because it has been associated with increased rates of severe constipation and also something called ischemic colitis, which is a restricted blood flow to your colon, which can be very severe. Another type of medication or class of drugs is called secretagogues. These medications are going to help increase the fluid sensation, and they're going to help speed up that motility in your GI tract. So linaclotide and flecainide increase the fluid secretion, and both are going to treat overall IBS-C symptoms. Are FDA approved for both chronic idiopathic constipation and also IBS with constipation. The next one is known as your lubaprostone, but it helps your stool frequency and helps increase it. It is currently FDA approved specifically again for IBS-C in women, but this is just due to the lack of men that were enrolled in the initial clinical trials. So while this isn't actually FDA approved for men, it has been known to be effective for them as well. Side effects include nausea and diarrhea for both of these medications, but typically just diarrhea for the 2, linaclotide and echinocandide medications. Another class of drugs is known as Retainagogues, and they do pretty much what the name says. They are able to help you retain water inside of your intestines by helping block the absorption of sodium that comes from the food or drinks inside of your GI tract. These drugs are known to help improve bloating, pain, discomfort. They can help speed up your transit time, or basically how long it takes for food to travel through your intestine. And it can also help soften the stools. Some side effects of this type of drug include abdominal pain, diarrhea, abdominal distension, and or gas. And then finally, the class of drugs known as antispasmodics help suppress or prevent your smooth muscle contractions in the GI tract. And these are typically divided into 3 different types, which are known as anticholinergics, direct smooth muscle relaxers, and also peppermint oil. And I do want to make note of what I put on the bottom, that the efficacy of antispasmodics has not been officially proven through studies and through research. So these are not typically also used by most patients, but can, and it has been shown to help by patients. So the first one, the anticholinergics, these reduce those spasms and the contractions. Side effects are actually really rare for this. So typically it can just include headaches, dry eyes and mouth, and sometimes a skin rash, blurred vision, or drowsiness. But like I said, it is pretty rare to have any side effects with this. Direct smooth muscle relaxers are actually not currently available in the United States, but if you live somewhere outside of the United States, these are the different types that you can get access to. This one specifically here is only available in Mexico. But again, side effects appear to be very rare. And then finally, you have the peppermint oil. There is a type of peppermint oil that is a brand name that you can get prescribed to you. But what peppermint oil does is it essentially blocks the calcium from entering into your smooth muscles in your intestine, which can help treat the overall symptoms of IBS and pain, and has been shown to have those anti-inflammatory or anti-gas properties. And side effects are really rare, but can be heartburn or nausea. And that's just because of the way and that's why I mentioned that there is brand names of peppermint oil, because sometimes if you have a coated pill, it can minimize the effect of the peppermint oil, which causes the heartburn and the nausea. So that's why some patients do get it prescribed versus just taking an over-the-counter peppermint oil. Other side effects can include skin rashes, headaches, or tremors. I kind of just want to leave you with some key points here, which is that IBS can affect all walks of life, men, women, and children. It is known as that functional GI disorder, meaning that your digestive system is going to appear normal on those routine tests. It can be chronic and long-term, which can also be managed by very simple dietary or lifestyle modifications, taking different medications, or using alternative therapies. The most troubling pain for IBS patients is the abdominal pain, and also diet modifications or any lifestyle changes should always be done under the guidance of a healthcare provider, such as your primary care physician and or a registered GI dietitian. And Haley is now actually going to speak with you guys a little bit about this month of April, which is our IBS Awareness Month, and kind of how that got started, and a little bit about how you guys can get involved.
Honestly, that was a really good presentation on what IBS is, how it's diagnosed, and the many treatment options that are available for patients. And that just gives us a good background to kind of jump into April this month being IBS Awareness Month, right? So I just want to give you guys with my presentation just a couple of details about how IBS Awareness Month was established, and also what IBS Awareness Month means to IFFGD and the patient community that we serve. So where I always like to get started whenever I develop our awareness campaign, I go directly to our IBS awareness site. So it's www.aboutibs.org. And I always like to go to our patient story section. And whenever I go there, it's mostly just so that I can understand who am I raising awareness for. So whenever I went to our awareness page in our personal stories section, I pulled a couple of quotes that I thought were very interesting and that tied into our awareness campaign this year, and I wanted to share that with you all. So the first quote being, "I've spent months getting all sorts of tests and blood work done, and everything always comes back clear. It's so frustrating." So this quote really goes back to what Alyssa mentioned during her presentation about how many patients go to their healthcare provider to get these tests to finally get answers for the symptoms that they are experiencing in life and realize that everything comes back normal. So then they feel like, what's wrong with me if everything is normal? So this quote is one that's very common also on our website, and it was one that really touched me and gave me the motivation for our awareness campaign. Another one being, I would turn on the shower at home and pretend to take long showers when in reality, I was in there with debilitating symptoms. To me, when I read this, I was thinking, how sad to actually be in your own home and the comfortability of your own home with people who you know love you and will always be there to support you, but yet your symptoms of a condition that many label as an invisible condition because they don't feel that they can actually express their disorder to others or the symptoms that they experience. But really, this patient was in their comfort of their own home, suffering alone. And that happens so commonly across the board to many people who are suffering with IBS. So lastly, one of the quotes that I felt was always in a patient's story on our IBS website, IBS impacts the quality of your life so much. So again, that just goes back to both of the quotes here, that IBS does impact the quality of life on so many different levels that I'll touch on a little bit later. But ultimately, we have to understand what those impacts are. And so I just want to go back to, what is IBS? So IBS is a gastrointestinal condition that causes recurrent attacks of abdominal pain or discomfort and is associated with bowel habits. This condition affects up to 5 to 10% individuals worldwide, as Alyssa mentioned, and can affect children and adults of both genders. So it's always important to know the who and the what the condition might be, who's suffering from this condition, what is the condition that I am trying to raise awareness about, because it's important to have that foundation whenever you're going out here to talk to others about a condition that maybe you're passionate about or that you suffer from. So it's always important to have those good key points to begin raising awareness for IBS during April. So when we go into this, now that we know the who and the what, a lot of things that also brought us back to the awareness campaign of this year is understanding how IBS can be so extremely unpredictable, right? Alyssa touched on the many different symptoms that affect patients who live with IBS, but those symptoms, as she mentioned, can vary from patient to patient. No patient is the same. And sometimes those symptoms can be contradictory. So you might have constipation one week, or you might have diarrhea another. And for many patients, the inconsistency for them leads them to live a life that is so debilitating that now it impairs their physical life, it impairs their emotional well-being, it impairs their economics. Many people can't go to work because they're suffering from their conditions. Many people miss days of school, especially being that it impacts children as well. So now you have a child who is suffering from IBS, they have abdominal pain one morning. Now the mother has to take off of work. So there's many aspects that IBS can touch on in the quality of life for not only the individual who's living with IBS, but also those around them. So when we're raising awareness, it's important for us to understand that this is why every April, and not only during April, but all year long, this is why we are raising awareness. We are raising awareness because of the impacts that it affects individuals and the quality of life. So what is IBS Awareness Month, right? So since April is IBS Awareness Month, I just want to touch on how IBS Awareness Month actually got started, right? So again, Nancy Norton was one patient suffering from a disorder on her own, and she established IFFGD. And that now IFFGD started with one condition, but now we have branched to multiple different conditions that we represent. But IBS was one of the first that we acknowledged on Health Observance Calendar in 1997, which gave us more of a breadth to be able to support patients who live with IBS. And a lot of times when we go out and we want to advocate for a certain disorder, we have to bring in the patient voice. It's important for us to not only come with our own experience and knowledge of what we understand about IBS, but really we have to be able to hone in on the patients who are actually suffering from this condition day to day. So what we do at IFFGD, we have a patient group who suffers from IBS, and we meet with them every January in order for us to get a sense of, hey, what are you struggling with? What was your biggest struggle last year, or just in life in general? What are some of the things that you wish the community understood about your disorder? And what are some of the things that you would like to see in our awareness campaign this year? And that is actually something that anyone who gets involved with IFFGD can actually be a part of, that IBS subcommittee, to help us be able to come up with a theme for IBS Awareness Month. So that is our how. We actually started that in 2020, and we found that that is very helpful in terms of being able to create our awareness campaigns for not only IBS, but the other conditions that we also represent. So for this year, our IBS awareness group actually stated that their symptoms were the biggest things that they wanted the general public to understand. They want the general public to understand not only how it impacts, but what are the symptoms, and also just to better understand the different ways that they can manage their symptoms, and maybe how other people who are supporting them can help them manage the symptoms that they experience day to day. So really these strategies that I'm going to touch on here briefly will just help you understand how you can get involved and how you might be able to help support IFFGD, because raising awareness about IFFGD and other conditions can translate into larger federal investment into research activities and stronger commitment from industry to develop new treatment options. So this is important to understand, mainly because, just like Alyssa mentioned in her presentation, a lot of the research studies either lack male counterparts that gave us a good variety, an idea of how these treatment options can actually help a group of people who are suffering from IBS. But it also is a way, whenever we are raising awareness and we're going to our congressional offices to speak on IBS or other conditions, it's also a way for them to realize that there's a group of people out here in this world, 5 to 10% worldwide, who are suffering from IBS that need our federal funds in order to increase the research that surrounds this disorder, so that now we can have some better treatment options, and we can have some options to help support the patients in managing their symptoms that they express as being some of the most debilitating things in their life. So again, how can you get involved in IFFGD's awareness campaign this month for IBS? Again, you've seen our hashtag that's here on top of all of our slides. You and IBS would be our hashtag for this year. But the main thing that I think is one of the key points in order to help raise awareness with IFFGD this year would be to just educate those around you about IFFGD's resources, about IBS, and about just why public awareness around IBS is so crucial. And the education can come from you, even if this is your first time hearing about IBS. If you can remember some of the key points that Alyssa and I have touched on, and you go to 1 or 2 people, those are 2 people that may have never heard about IBS, and that is your form and your way of raising awareness and supporting people who suffer from irritable bowel syndrome. So another way that you can also get involved with IFFGD to raise awareness this month is to join us on social media, right? Join us on social media. We're on Facebook, we're on Twitter, and we're also on Instagram. And this month, we will be able to share all of our campaign images and also just some stories from patients of how their symptoms have impacted their day-to-day life. And lastly, if you are a person who suffer from IBS, or you know someone in your family who suffer from IBS, I think it's going to be important for you to share your story. It's very important for you to share your story about how IBS impacts you, because again, when you start with the who, it makes it a lot easier to raise awareness and be more encouraged to really bring in that touch so that everyone can understand really who it impacts, because everybody, it's important. Everyone wants to know, okay, who is it and what does it look like, right? So this QR code here at the bottom is a QR code that will take you to our Dropbox, and it will give you all of your resources that you'll need. So you'll find in there our IBS awareness infographics. You'll also find IBS awareness social media images, and you'll also find our IBS awareness toolkit, which gives you key points. If you aren't sure what to put on social media, there's some social media tips in the toolkit that will give you some good touch points to be able to speak on whenever you're on Facebook, Twitter, or on Instagram. You'll also be able to use any of those social media images. The only things that we ask whenever you share on social media is to use this hashtag that's at the top, UNIBS, or you can also use hashtag IBS Awareness Month. That just brings the whole campaign back together, and it really gives us a good idea of who's helping to raise awareness and how many people are raising awareness out there about this condition. And I know that our patient community will be so thrilled to have your support and to just know that they're not alone out here, and that there's many people who might not even suffer from IBS, but they're still out here to support them and wanting to raise awareness, because it is so debilitating and impacts their day-to-day life and their quality of life. And everyone wants a good quality of life, regardless of what conditions we suffer from. So I just want to leave you guys with our information. If anyone wants to get involved with IBS Awareness Month, feel free to reach out to IFFGD at iffgd@iffgd.org, and we'll be able to lead you to more resources or give you some good key points to help you share your story or other stories, or just to help you raise awareness this month. You can also find a lot of our resources at www.aboutibs.org, which will give you some fun facts and some key points to help share information and educate the general public or those around you about IBS. But it's very important for us to just understand that this month, being April of IBS Awareness Month, is very crucial for all of us to be able to join the other patients who are suffering from IBS, but also not just during April, but all year long. We can raise awareness for not only IBS, but other conditions, and we can always support each other. No one's alone in this, and we're always together.